A patient recovering from a vasectomy is prescribed Chymoral. Why is this medication appropriate for this patient? A. It prevents post-operative infection. B. It reduces swelling from the procedure. C. It promotes faster wound closure. D. It relieves surgical pain directly. Correct answer: B. Chymoral is a proteolytic enzyme combination used to reduce inflammation and tissue swelling following surgical procedures. It works by breaking down inflammatory proteins and reducing edema at the site of tissue injury. After a vasectomy, local inflammation and swelling are common. Thus, Chymoral helps decrease these symptoms and promotes faster recovery without directly relieving pain or preventing infection. A nurse is educating a patient receiving Gentamicin for an infected surgical wound. How long should the treatment typically last? A. 3 to 5 days. B. 14 to 21 days. C. 10 to 14 days. D. 7 to 10 days. Correct answer: D. Gentamicin is an aminoglycoside antibiotic that targets gram-negative bacterial infections. The standard duration of therapy is 7 to 10 days, which provides enough time for bacterial eradication while minimizing the risk of nephrotoxicity and ototoxicity, two major side effects of the drug. Shorter courses may be ineffective, and longer durations increase toxicity risks, so maintaining the 7 to 10-day range is clinically recommended. A patient with leprosy is prescribed Dapsone. Why is this medication appropriate for this patient? A. It kills viruses causing skin infections. B. It inhibits bacterial growth of Mycobacterium leprae. C. It reduces inflammation in skin tissues. D. It boosts immune response against bacteria. Correct answer: B. Dapsone acts as a bacteriostatic agent against Mycobacterium leprae, the causative organism of leprosy. It inhibits the bacterial synthesis of folic acid by blocking the use of para-aminobenzoic acid, an essential component for bacterial growth. This interference slows down bacterial multiplication, thereby controlling the infection and preventing further tissue damage in leprosy patients. A patient in cardiac arrest receives epinephrine intracardiacally. How does this medication help in this emergency? A. It reduces heart rate to stabilize rhythm. B. It dilates coronary arteries to improve blood flow. C. It stimulates heart activity to restore circulation. D. It prevents further cardiac damage. Correct answer: C. Epinephrine is a potent adrenergic agonist that stimulates both alpha and beta receptors. During cardiac arrest, its beta-1 effects increase heart rate, myocardial contractility, and conduction, helping restart cardiac electrical activity and restore effective circulation. It also causes vasoconstriction via alpha receptors, improving coronary and cerebral perfusion, which is critical in resuscitation efforts. A patient in pregnancy is prescribed folic acid. Why is this medication appropriate for this patient? A. It prevents neural tube defects and anemia. B. It prevents respiratory infections. C. It enhances blood clotting. D. It reduces morning sickness. Correct answer: A. Folic acid, or vitamin B9, is essential for DNA synthesis and red blood cell formation. During pregnancy, the demand for folate increases to support fetal development. Supplementation prevents neural tube defects such as spina bifida and anencephaly in the fetus and reduces the risk of maternal megaloblastic anemia. It is a standard prenatal vitamin recommended before and during pregnancy. A patient with a history of optic neuritis is prescribed Ethambutol. Why should the nurse question this order? A. It may cause severe gastritis. B. It is contraindicated due to optic neuritis history. C. It increases anorexia risk. D. It causes peripheral neuritis. Correct answer: B. Ethambutol, an anti-tubercular medication, can cause dose-related optic nerve toxicity, leading to visual disturbances such as blurred vision, red-green color blindness, or even irreversible blindness. For this reason, it is contraindicated in patients with a history of optic neuritis. The nurse should report this finding to the healthcare provider before administration. A patient with a respiratory infection is prescribed Chymoral along with antibiotics. Why is Chymoral included in the treatment plan? A. To enhance antibiotic absorption. B. To reduce antibiotic side effects. C. To prevent antibiotic resistance. D. To reduce inflammation from the infection. Correct answer, D. In respiratory infections, tissue inflammation and swelling can interfere with effective breathing and healing. Chymoral, through its proteolytic action, reduces mucosal inflammation and helps clear inflammatory debris. When given with antibiotics, it enhances tissue recovery and reduces the intensity of symptoms such as congestion and edema, promoting faster recovery. A neonate with sepsis is prescribed Gentamicin. What is the correct dosage for this patient? A. 6 mg per kilogram per day in 2 divided doses. B. 3 to 5 mg per kilogram per day in 3 divided doses. C. 2 milliliters single dose daily. D. 120 milligrams daily. Correct answer, A. Gentamicin dosing in neonates is carefully calculated to ensure effectiveness without toxicity. The recommended dosage for premature infants and neonates is 6 milligrams per kilogram per day, usually divided into 2 doses. This schedule maintains therapeutic plasma levels while allowing sufficient time for the kidneys, still immature in neonates, to excrete the drug safely. A nurse is monitoring a patient on Dapsone who reports fatigue and pallor. What should the nurse prioritize? A. Monitor for insomnia. B. Assess for signs of anemia. C. Check for fever. D. Evaluate for nervousness. Correct answer, B. Fatigue and pallor are classic signs of anemia. Dapsone may induce hemolytic anemia as an adverse effect, particularly in patients with glucose 6-phosphate dehydrogenase deficiency. The nurse should assess the patient's hemoglobin levels, monitor for jaundice, and report findings to the physician to prevent severe anemic complications. A pregnant patient with post-operative edema is prescribed Chymoral. Why should the nurse question this prescription? A. It may cause fetal bleeding. B. It increases maternal infection risk. C. It is contraindicated in pregnancy. D. It causes maternal hypertension. Correct answer, C. Chymoral is contraindicated in pregnancy because its enzyme activity can affect protein metabolism, which may pose risks to fetal development. No sufficient safety data support its use in pregnant women. The nurse should notify the prescriber and suggest safer alternatives for managing edema, such as rest, elevation, or approved anti-inflammatory medications. How many questions did you get correctly? Drop your score in the comment section and subscribe for more NCLEX questions and answers.